Mark Giles. So, technical challenge. Yet another new introduction to our meeting. And thanks to the lack of Swiss minutes this afternoon, we only have 1 hour before we've got to get you on the bus. So hopefully we do have enough time for that. We have Wiro Niessen, who's the immediate past president of MICAI. You may not know, but MICAI is almost a sister society to the SMRA, and we have the same secretariat in J Squared. So Wiro's going to give a brief introduction to this, and then my co-collaborator in setting up the technical challenge, Peter Douglas, over here is going to give a quick introduction as to how we set up this particular challenge, and then we have our two ultimate challengers, ultimate fight partners to tell them which is best. Okay, so Wiro, if you can take us away, thanks.
Thank you very much, Giles. It's great to be here, and I would like to present a little bit on the importance of challenges, especially in the view of all the technologies that are being developed. I think from your field, a lot of imaging techniques become quantitative. We just heard a discussion about that. And increasingly, images are being interpreted, and they are leading to clinical diagnostic systems. And the question really is, how do we make sure that these methodologies actually improve clinical practice, and what are the ways to go forward? And that's far from trivial. So my disclosure, I'm also involved 1 day a week with a startup company, which is in AI, in medical imaging, by the way. So we all know that imaging and health has revolutionized because of data science, at least the research in it, not yet the clinical practice. And the reason it's biggest in medical imaging is because the most striking results of AI came in the field of computer vision. Very well known, the ImageNet competition, in which you had to label whether certain structures were present in an image with algorithms. And this ImageNet challenge in 2012 was won by a group from Montreal that used a neural network. If we look at this neural network and the steps that have been made, it's really clear that they've been working with larger data sets than we are using typically in medical imaging. So at the moment in the ImageNet, there's about 14 million images that have been hand annotated, and in more than 1 million certain regions have been provided, and in total more than 20,000 categories have been identified. So this is a very rich data source, and this rich data source was really at the beginning of the revolution of AI in health, or AI in general in data science, but also in health. So it's really successful to put up a challenge like that. And I think the reason why this challenge was so successful was because of two reasons. First of all, there was a clear, large open data resource, clear definitions of what it took to win, and there was the challenge aspect, and especially people in these domains really like to be challenged and to be able to enter in competitions. So also in health, we think we can make a great impact with AI tools. But if I'm really honest, so far, people in my department, radiology, have been worried whether they were going to be replaced. But so far, their clinical practice has changed little because of AI. And my practice has changed totally because I don't have a single PhD student anymore that doesn't want to work with deep learning. I sometimes like that people also keep on thinking about problems, etc. But the technique has been so powerful that has been totally disruptive in the field of medical image analysis. If I look at the conference, the MICAI conference in 2014, we had one paper on AI in 2014 on deep learning, and now it's about 75% of the conference. But initially, there was the reaction, a little bit worried reaction of the clinical field that they were going to be afraid that they were going to be replaced within 5 years. Those claims were made in 2016. We're already past 3 years since those claims, and not so much has happened. So now there's almost the opposite claim. There's the claim, show me what it's worth, that you can really improve clinical practice with these technologies. In the end, I think these techniques are very powerful. I've seen that certain tasks can be done so much better and we can make a big impact, but it really requires a lot of work in order to make sure that something that works in principle works in clinical practice. And in the health domain, there's particular challenges. Every week now you get an article that something can be done with AI very well. There was the article by DeepMind that they could predict acute kidney injury up to 2 days before it happens. And this is a very nice study. It's quite an impressive study. They looked at 703,000 patients. They looked at 620,000 data points, and they worked with machine learning techniques in order to figure out that about 3,600 variables were predictable, and they could predict up to 2 days before in a certain number of patients that indeed acute kidney injury happened. But if you look at it carefully, if you go away from the popular press that again shows that something is going to be replaced, you have to realize that in this paper no single actual prediction has been made. This is purely a retrospective study. The accuracy in the end is 55.8% and also depends on the time to the event. Also, and this is even more important, the data set is very biased. It's from the US Department of Veterans Affairs, so people in the army, so mainly people that are male, so it's a very biased population. And if you have a biased population and you develop an AI methodology, you don't know whether it generalizes to other populations. So we are confronted now with the situation in medical imaging that we're going to have multiple solutions, AI-based, which seem to work very well, but how are we going to be able to really determine that they're going to make an impact in clinical practice? And therefore, we need to set up proper validation strategies that are really within the academic field, and the clinicians need to take a leading role. The reason for it is if you look at how algorithms are made, you typically have a training, testing, and validation set. And most, if you critically look at 90% of the papers, you will see that they do a nice job of separating the training and the testing set. So they do cross-validations, etc. But still, the performance they're showing is indicative of the performance on that particular set. The moment that you bring an algorithm to the market and you let it run on a different population in a different hospital, you may have a totally different setting and you don't know how the algorithm works. In order to really work better here, we need to have more multi-center data, and you have to evaluate the method on a totally independent data set. One of the poster presenters actually, I think from the University of Calgary, had a talk where they were using those kind of concepts, so I was very happy to see that. So this is really important to do. I think the concept in order to start to organize this in the medical imaging field has already been long around in the field of computer vision. Already in 1986, Keith Price was claiming that people keep on putting papers and papers in which things were done better and better, but nobody could really check it because the science was not reproducible. So we simply cannot assume that if we're told that a certain algorithm works, that it actually works, and we need to assess it. So I think challenges, although they've been primarily been used in the research domain so far, may be a very good way in order to go forward, in order to make sure that we have a framework to test whether algorithms can be used in a clinical settings. There have been many challenges done now in biomedical image analysis, most at MICI and ISPI. And the great thing about organizing a challenge is basically that you pose a problem that you would like to be solved. You give data for people to train on it. You have a set of rules in order to determine when an algorithm works well. And then nowadays, if you provide this data, you get the whole world to work on your problem. It's actually a very cost-efficient way in order to get a problem solved. So here is an example of one workshop we organized in the MICI workshop on trying to classify dementia on multi-parametric MRI images. Within 2 years, you see that many groups in the world are using the data and trying to provide tools. And you get this nice ranking of methods in order to objectively compare. So I think this is perhaps also the future for AI tools in radiology, that we would have challenges and make sure that people run their algorithms on challenges in order to be able to test how they are working. Still, challenges are not optimal. We've done a challenge review. This was led by Lena Meyer-Hein of the DKFZ from Heidelberg. And with 29 teams, we looked at all the challenges that have been organized in the field of medical image analysis. So far, about 150 of these challenges have taken place. And mainly, most of these challenges have been initiated by people that are producing image processing algorithms. So that's a little bit of a disadvantage. It's like the butcher testing their own meat, even though people like to do a great job and organize these challenges. They've been a bit bottom-up, which also means that the metrics that are being optimized are often metrics that are relevant to computer science researchers, like volumes and ratios, etc., whereas perhaps for clinical practice other endpoints may be important. Also interesting, most of the challenges are relatively small scale, and the reason for it is that most of the teams are capable of working, are either connected to 1 or 2 hospitals, and in this way they get a number of data sets. So another thing is that even in challenges there is a lot of variability. A lot of metrics are being used, and this makes that the same, what's true that the performance of algorithms could not be compared, that sometimes challenges cannot be compared. So a lot needs to be improved there. We think that we really need to move the full field forward, and it requires collaboration between the people that eventually going to use these algorithms, the AI algorithms, and the people that develop them. So we have to go to the next generation or high impact challenges. These should be challenges that address clinically very relevant problems with a clear definition of the task, the workflow, and evaluation metrics. Ideally, challenges that even show how methods are going to be incorporated prospectively in the workflow. We should have a proper challenge design, and at least because of the critical review we did, we have now guidelines in order how to design a proper challenge. You need sufficient training data, and there I think there is the role of the clinicians. Rather than waiting for good algorithms to come, I think it makes a lot of sense if you are in a certain specialty to collaborate in order to provide multi-center data with labels such that people have the training data to construct good algorithms and also are able to evaluate the data. And we really have to work with the concept of totally independent test data, and we have to test to put algorithms to the ultimate tests. We started collaboration between MICAI and some of the larger radiological societies. And the most interesting collaboration now, I think, is to bring together AI use case scenarios and challenges. So the ACR, the American College of Radiology, has defined a number of use cases in which AI is very relevant and could make a contribution. And they have basically indicated what they expect from an AI algorithm. I think the field should back up those scenarios with data sets and criteria such that different industries can develop methods and evaluate those methods. So also this community, I had talked with Giles, started to think about challenges, and I think we did something a little bit ambitious here, because we organized a challenge for algorithms, knowing there's a lot of people doing all kinds of image analysis approaches. But as a first challenge for this community, it may not be the easiest challenge, because it's a challenge without a real ground truth. Because it's about trying to improve the visualization in images of the legs in which both the arteries and veins are enhanced. So basically it's an artery-vein separation problem. And the end product of an algorithm here is improved visualization. And that you don't give so easily to a computer scientist, and he can use as a criterion in order to optimize an algorithm. Still, I think it's very exciting because it's a new class of challenges. And I've seen a number of other presentations today about a vessel wall MRI, and both in the carotids and the coronaries, where I think there's a lot of potential for the challenges. So this is really a new type of challenges. It's probably much more difficult to organize because it really requires a bit of subjective interpretation to look at the results, but it's also important, so I look forward to the people that competed in the challenge And I think now Peter Douglas will introduce the next part of the challenge. Thank you.